It has caused a lot of anxiety, stress, tension, fear in the lives of people around the world. Yes, I'm talking about the new coronavirus, COVID-19. Wherever we go, we see people in masks, schools, offices are all shut down, everybody working from home, public places are deserted, doctors, nurses, and office staff are working round the clock. We do have some other essential workers who we really need who are still working. California declared shelter in place for about more than a week now. This is the situation we are in today. I am Jasmine Parole for Elista Media, and today I have with me Dr. Jacob Eapen, MD, MPH, Director of the Alameda Health Systems, and an elected board member of the Washington Hospital, Fremont, California. He is a distinguished alumni of Stanford University and University of California, Berkeley. He has worked in Tanzania, Nigeria, and also worked as a health advisor for United Nations High Commissioner for Refugees in Philippines. He lives in Fremont with his wife Shirley and his two children, Dr. Naveen and Dr. Sandhya. Let's welcome Dr. Jacob. Hello, Dr. Jacob, and thank you very much for being with us and spending this time with us today. Can you please shed some light on the situation that we are in?
Right now we are in the midst of this pandemic of COVID-19. It's been spreading around the world. Some of the countries are hit more badly than others. Some other countries had the epidemic peaked earlier than us. But right now it's really spreading in USA. It's all across. The hotspot is probably New York. They have the maximum number of cases. Obviously, it's a much bigger city, much larger population. Washington State is probably number 2, and then California. California also is a large state, and the number of infections are going up. I think just within the last 24 hours, I think they have had about 6,000 new cases. Even mortality, the death is also slowly starting to go up. I'm told that even today in the Bay Area, we have lost about 2 or 3 lives. The thing about this corona or COVID-19 is that the mortality rate is not that high. It's between 2 and 3%, which is not that high. Basically, if 100 people gets infected, the chances of somebody dying would be 2 or 3 out of 100, which is much less than a lot of other coronaviruses. Coronavirus, the class itself has got about 7. There are 4 types. It's alpha, beta, gamma, delta. There are 4 classes. But there are about 7 types of coronaviruses that have infected human beings. 4 of them have been around. It's been all around for a long time, which just causes common cold, just upper respiratory infection, running nose, a little bit of cough, it just goes away. We call it as normal flu. But in the last 2 decades, we have had 3 new coronaviruses. One was MERS, that is a Middle East respiratory syndrome, which apparently came from camels, because all these are zoonotic. Zoonotic means most of these viruses originally come from animals. And the second one was SARS, sudden acute respiratory syndrome. Then the third corona was COVID-19. But compared to MERS and SARS, the mortality rate of SARS was maybe about 10 to 15%, and MERS was about 30%. And like I said, for COVID, it's 2 to 3%. So compared to the other 2 coronaviruses that have come in the last 20 years, I would say the mortality for COVID-19 is much, much less. But at the same time, it's not something to be taken lightly. Generally, like any other infection, when there's a pandemic, the people who are really affected are the people who are elderly, who are immunocompromised. Even elderly, they are immunocompromised. The immune system is weak. But having said that, the teenagers also could be infected, but they're able to fight it off much better. That's one of the reasons why even in China, in Wuhan, where the whole epidemic started, there were only 9 reported cases in children who were less than 1 year old. And so far, thank God, no deaths have been reported around the world in children. And me being a pediatrician, I see a lot of children every day with pretty much similar symptoms. So my only consolation is that the mortality rate in children from this infection is almost 0. They have also identified 2 newborn cases with positive COVID. They're just born and they were positive. One was in China, and the second, I believe, was in England. And so, although we say a droplet and airborne infection, that is a way of transmission, but when you have a newborn being affected, there is always a thought about other modes of transmission. Can it have been transferred from the mom to the baby even before it was born? So this is such a new virus. There's so much of unknown, and we are still learning.